All right, we ready to roll?
We're ready.
All right, let's do it. Welcome back, everyone, to the Mid-Level Show. I am your host, Ben Rogers. Just a quick recap as far as what this show is. This is where we get the people inside of our offices treating patients. We get their views on this week's Doctor's Note, the Performance Weekly that goes out every Monday. And this week is a really interesting topic. Dr. Rogers is talking about back pain, and that's kind of hit close to home for me and my family, and of course Dr. Rogers and his wife, my parents. So we're gonna jump right in here, guys, and I'm gonna start with you, Amber, because of your experience in a neurological surgery clinic. Is that the correct way of saying it?
Neurosurgery. Yes,
neurosurgery. So why don't you go ahead and just give the audience here a brief background on that, kind of what you did and your perception of the article that went out this week.
It was a great article. I was saying about before we started how all of these things I thought I was going to hit on, Dr. Rogers totally went down the list and hit. And I was like, well, way to go. What a, all-conclusive article. But so prior to performance medicine, I worked for 3 years out of grad school at a neurosurgery office. But I was on the pain management side of the practice, so the non-surgical. So, back pain or neck pain was pretty much my everyday. And those were people who had surgery, who had not had surgery. They were, it wasn't just medication based. We did a lot of epidural steroid injections or SI joint injections. So kind of like beyond your primary care with back pain after you've had an MRI and there's some pathology happening, the next steps of how to handle that pain in that clinic.
Yeah, that's really interesting. That sounds a lot like, what Mom was going through this past week with her pain, just trying to, relieve some of the pressure there. Was there anything in the article that stood out to you as far as, treatments and prevention that you really connected with?
I thought it was very well written. There's a couple things that I learned that really struck a chord with me, having worked at a neurosurgery clinic, but also through the article. Back injuries, I should say, are not always one massive event. I had so many patients who it was kind of like the straw that broke the camel's back. Their back went out when they were exiting a car or when they were bending over to pick up a small object. It wasn't when they were, lifting a ton of weight, even though, as Dr. Rogers said, that's a surefire way to injure your back. But sometimes it's these little bitty tiny straws that pile up. And then, if you're not doing those things, as he said, core stability and core training is absolutely key to a strong back. And so those kinds of things. My biggest takeaway for back pain, a back injury, whether it's a massive injury, obviously, if it's a massive injury, and then go to the ER. But if you have some back pain that you wake up with and it's self-limiting, do steroid. Anti-inflammatories for about 72 hours and rest, ice, heat, and then you may have to come, get a steroid or something. And then, you don't want to immediately jump to imaging, unless, of course, now Kara in the ER, we always would send patients, of course, if there was bowel or bladder incontinence. If you have a back injury that leads to that, you go to the ER. Kara, did you ever see that?
We did, yes. Mm-hmm. I thought it was amazing how many people have back pain and the cost of treatment that he mentioned early in the article. With performance medicine, we're trying to stay focused more on preventative and on prevention. So I think that's really important for our patients too. And also with the anti-inflammatories, make sure you're taking them with food and that you're spacing them far enough apart, because, that can have some long-term effects, on your kidneys and liver and things like that. So it's very involved.
Yeah,
when you're treating somebody with back pain.
I agree. And Andy, I'm going to let you pick up there because you've mentioned to me in the last couple of days just about the importance prevention is for you and how you're seeing a chiropractor and stuff for your own back. Why don't you, piggyback on what Kara was saying there?
You're saying so many trigger words right now. I will pick up, but with my back. And sure, I will
Knees,
piggyback
your knees.
on what was it. But with your knees, lift with the knees. Yes, not with the bag. Yeah. Before I talk about that, yes, I've had a recent back injury, but I don't even want to call it an injury. I was doing a Sean T 25-minute video and did something that I shouldn't have been doing, and I felt a pop. It hurts. It got better. So I don't want to put me in the category of like crazy back pain. But I do find that chiropractic work has been a godsend to me. It has really relieved my everyday pain and stiffness. But okay, this is off of what Karen and Amber have said, because you all have worked in neurosurgery and a pain management side and ER. Do you not, coming out of school, I'm a year out of PA school, everybody is scared to death of opioids. So whenever I see chief complaint of back pain, my eyes are like this, and I don't really want to touch that. Did you all feel the same way? As providers, I feel like I have an automatic negative connotation. Did you all feel the same way? Is it because of our training? Is it because everybody with back pain, you have this red flag of somebody's trying to get something out of you? Did y'all feel that way? I don't want to put y'all on the spot, but did y'all feel that way? 'Cause I feel.
I think things have gotten worse now than when I graduated. But I think it's very important not to become jaded, because people can come in with back pain and they can have like a AAA. So I mean, you always need to evaluate. The history is the most important part of the exam, and just make sure that is indeed what it is. But I think in more recent years that the opioid crisis has made us, more hesitant. And I think there are laws that only allow Schedule IIs for a certain period of time. And I know there's a lot of doctors that, are not writing them. They're using a lot of other, like Tramadol or Flexeril or something like that. What about you, Amber? What did you all do?
Oh, well, I mean, the thing is, we were a certified pain management clinic. So opioids were a part of my everyday, but it was always given a certain criteria that a patient met. It was not for a patient who had a normal MRI or no prior surgeries, or for new patients. It was one of those things that was for an acute injury where there was pathology on an MRI, as you said, to get them. On a more chronic level, there was some patients who had tried a litany of other things without success. In our clinic and our practice, I feel like we do a great job. We're going to kind of be that bridge. We don't prescribe opioids, but we are going to do those steroids and anti-inflammatories and muscle relaxers to at least in that hyperacute phase. Because here's the thing, 98% of even disc herniations can heal. Am I cutting in and out because my screen is kind of, okay, good. So they can heal on their own without surgery. Now, that doesn't mean all surgeries are necessary, but the thing is, we're a great bridge to in that hyperacute phase, and then if needed, you move on to a neurosurgery type clinic or pain management where you can have some injections or of that nature.
I think it's important for providers, if you're listening to this, to not, I think with what you said, Karen, not to get jaded, because from right now, that is my first night, my number one thing. I think when I see back pain, chief complaint, I think this person wants an opioid. And that's not true. I just witnessed it this last week with mom's back going out. She can't walk, and she can now, but it's a scary thing and not a pain-seeking thing. So I think that's taught me a valuable lesson as a provider to not jump to that conclusion. But it's also made me think, whenever you see what your parents go through, it makes you want to avoid it like the friggin' plague. I do not want what just happened to mom. So all these exercises he talks about, really strengthening core and strengthening your back with paraspinal muscle exercises, and not trying to go to the gym to be this huge shoulders, huge chest, hunched over, huge legs, but really protecting your back with good posture, and doing yoga, Pilates, that type of exercise. To me, ages well. And so that's really what I took away from this is, God, if you don't want something to go out, you don't want your back to go out.
Yeah, I love that, Andy. And Fran, why don't you say kind of what your thoughts were? I know you're just listening to the podcast episode.
Well, I listened to it on Monday. I was just re-listening to it, but from a personal perspective, I've been through all this. I've had back surgery. I've dealt with back pain, so I would never think somebody was actually trying to get opioids, because you can tell when someone's back is in spasm. It is the most painful thing. You cannot move. You can barely move your arms. It's horrible. So there are so many different things to help you get out of back pain, like was already mentioned. But you can do all the right things. You can exercise, you can lift weights properly, and you can still wake up one morning and not be able to get to the bathroom, which is what happened to me. And wasn't overweight. I had not stopped exercising. Something happened, and it took me 2 years to, I finally ended up having surgery after doing all the alternative things. I started with chiropractic, and everything helped for a while. I had epidural steroids. They were wonderful. I was like a new person, but it was a Band-Aid for me. And when it wore off, I was right back in pain. So after 2 years, I finally decided, I want to be able to ride my horses and lift hay bales and function again. And I had a microdiscectomy, and today I'm great.
Awesome.
But I do twice a week, I do strength training, core strength training with a personal trainer to make sure I do it correctly to keep my back from going out.
It's so
I never want to be like that again.
It's so interesting. Go ahead, Andy. Go ahead.
Have you had any?
I can't hear you, Andy.
I was going to have issues since then.
After my
any
surgery,
spasms that have
a few times playing tennis, I had some issues, and that is when I decided I needed the personal trainer. And since I've been doing the core strength training twice a week, never miss it, I have been fine.
How long ago was your surgery?
My surgery was in 2013 or 14. So long time ago.
Well, one thing I was going to ask you, Fran, is what are some of those exercises that have really helped you? Out of curiosity.
The one was, he mentioned it in his note. Now I'm drawing a blank on it. That one method, is it McKenzie method?
Yes.
Where you lay on your stomach and you push up. I did a lot of the McKenzie method. I did ego skew. I did everything that was out there. I hung upside down by my feet.
He's a big proponent of that, actually. The thing where the inversion. That's right. That inversion therapy, and I actually got a few emails from the website after the note went out about that, which I find fascinating. It does. I don't know exactly how it works, but maybe it's a blood flow thing. Maybe it's just a stretching things out
You're
sort of
talking
thing.
about inversion tables?
Yeah.
They decompress. When you're turned upside down, it just kind of pulls your vertebra apart and decompresses.
Have you found success with that, Amber? Have you seen that work pretty well for people?
My dad does it faithfully. He was similar to Fran, not an overweight guy, very active, and his back went out getting out of the car one day, and he was in the floor for almost 72 hours. And we were with him. He wasn't by himself, but his inversion table but unlike Fran, he was kind of a non-surgical. He has a severely degenerative disc in his lower back with barely any disc left. It was almost like an autofusion. So his was more of a degenerative type pain, but by doing the inversion table, he gets a lot of good release from those vertebrae, just kind of pulls them apart a little bit.
Sometimes there's injury with women, like in childbirth, L4, L5, L5S1. You'll see that sometimes, not immediately after, but sometimes later. So
the
probably what happened.
The degeneration or
kids.
SI joints are very common in women, childbearing women, or women who've had children. So that's why with your mom, when they said SI joint, I thought, oh, yeah,
Well, one thing I'm noticing, and I was in the Kingsport office yesterday, is everyone has a back pain story of their own, and just like Fran was saying, and just like Amber was saying with her dad, I feel like it sounds kind of bad to say you're just waiting for that straw to break, but man, it seems like it's very common, and it's something that is super debilitating, and it's worthwhile to do everything that you can, to prevent, just like what Fran is doing now, and what I know a lot of us are trying to do. But it does seem super common, and the one thing Dr. Rogers said in the article is that it's really debilitating. It's like a very common thing that can really throw your life upside down, literally and figuratively. And I see, Andy, you're nodding your head there. You got some thoughts on that?
No, yeah, because Dad's back went out probably 15 years ago, 16 years ago. It was just us in the house, and it was in the middle of the night, and he was banging on my wall on the floor. We had to get my granddad and my uncle to come over and help, and it was it is no joke. I don't know. I think it's a scary thing to happen. When it happens to you, just don't forget it.
Well, and also too, if anyone's listening and it has happened to you, or take the knowledge away from it, that if it happens to you or if it happens to someone most important things you can do for them, don't panic. Obviously, if there's radiation, that's a big thing. If it's back pain, that's one thing. But if there's pain that's radiating down in a specific nerve line, down one or both sides of into the buttock, or down the legs, or around into the groin, manage it initially. If it's an injury, take an anti-inflammatory and a steady dose, rest, ice, heat. Make sure you're not I'm just gonna work through this pain, because you'll end up compounding an injury. So take away what you can do, and obviously make an appointment with a doctor so that they can kind of see, is a steroid warranted? Do you need a muscle relaxer? Is there spasming? If things do not improve, then that's when you're going to start looking at, do we need imaging and things of that nature.
I want to follow up with that, Amber. When would you suggest somebody go see somebody for this sort of thing? If you are having back spasms or back pain, do you wait till you get to the point where you're on the floor and can't get up? Is that kind of the...
It depends on the injury, because if it is a massive injury like that, like a little injury that, turns into something where you can't walk, then of course you're going to want to call and be like, oh, I need to be seen. Even if you do recover in 72 hours, let's say you can't get in immediately, but getting somewhere, if you feel like it's something that can be managed with like an anti-inflammatory, if you have a muscle relaxer and you can rest it out about 72 hours, you can see. If you have any type of radiation, bowel bladder incontinence, like that's an emergency. So that's something that you can't wait on. So it just depends on what you're presenting with. Pain is not necessarily indicative of, I'm going to be rushing to surgery right now, but it could be serious. So you just have to know your body and listen, and try these things. And if you don't get any relief, then take the next step.
I love that. And I mean, one of my big takeaways from this conversation here is number one, as providers, not being jaded with pain, because I know that's a scary thing from a provider standpoint, and it's kind of top of mind, I know, for most people seeing patients. And the other thing is just prevention and knowing the things that you can do to avoid situations like that, and being safe with the way you're lifting things, with the way you're working out, and also knowing that there's things that you can do. And I think Fran's a perfect example of that. Of there's procedures, there's treatments out there that can get you back on your feet, and living your best life, quote unquote. Guys, is there anything else that we want? Andy, you want to say something before we rock out here?
I just want to cross reference to more of what we do at Performance Medicine. Yes, addressing kind of the acute back pain, but also the hairy back, which you do suffer from, Ben. So we can fix that as well. Our highly trained aesthetic department takes care of that. She can not only wax, Jasmine and Kelly, Jasmine is in Knoxville, Kelly's in the Tri-Cities, can take care of that hairy back through waxing, through laser, through prayer, whatever is necessary. So we can help out with that as well, Ben.
And
Just
a
to
plug
support.
in
Yes.
medicine for Ernie, who, if you need help with a diagnostic tool of where, I mean, this man, his knowledge of anatomy, he can literally pinpoint which lumbar vertebra, or if it's a muscle, if it's a side joint. So if you are having back pain and you're unsure, you don't even need imaging. Just see Ernie.
Just see Ernie. I love it. And what'd you say, Andy?
What?
Oh, I said he's a magician. He's amazing.
He's incredible, and he's been on a couple of our shows. So for anyone who has not gotten to experience his wealth of knowledge just on physical therapy and all things, strength. To be honest, you guys got to check him out. We'll probably have to get him on the show here shortly. Guys, great insight. And Andy, I didn't expect that with the back here. I need to schedule an appointment with Jasmine ASAP.
Just tell her to grip it and rip it.
Grip it and rip it.
I'll be gone.
Guys, great insight today. This was such a fun conversation on a very common reason that people go see the doctor, and something that can be, as we've said, very debilitating. So thank you for the insight, guys. Thank you for the time. And as always, we're going to see you guys next week. Listeners out there, thank you guys for checking out the show and hanging out with us. If you have not subscribed to the podcast on Apple Podcasts or Spotify, please do. And if you have not subscribed to the YouTube channel, we work really hard on that. We'd really appreciate it. Thank you guys. Love you guys. We'll talk to y'all soon.
Thank you.